on the glass half full side, you'd say it's still less than 50% showing decline into the 80s. Of course, if you're on the salt house kind of side, you'd say, look at the steepness of this, the increase in percentage of decline, and the stability is coming down. So a little bit interesting, but you've got maybe 5-7% of people in their 20s are showing significant decline over 7 years of testing. Because it increases over time. And only about less than 20% showing gain. But anyway, just making the point that not everybody's moving in the same direction, even though the averages are moving. And we've got fairly large numbers of people, fairly large percentage of people still showing either gain or stability, even out in the 80s. So when, in contrast to the picture that we started with in the sort of up to the 1970s, and as you see from the readings throughout most of the 20th century, rather than people declining in everything, the actual trajectory of age changes and intelligence depends on the particular kind of intelligence you're looking at. Rather than this image of steady decline from young adulthood onward, a lot of the factors stay fairly stable on a group-wise basis out till late middle age, young old years, something like around 60, give or take 5 or 10 years. The trajectories are at least complicated by cohort and time effects and other things going on. I like the summation that Liz and Rob Haslinsky and Kennison are arguing it's not your father's intelligence. People actually up to 15 points higher by kind of effects. That's a couple of early 20th century keywords. We'll talk about the modifiability more next week and the ups and downs of that. But the short answer is certainly like memory that we talked about in the last week or two. You can train people on specific skills and show improvement on those specific skills for short periods of time in non-generalizable kinds of ways. The big sort of issue is whether you can do it to have lasting effects and what the reality of use it or lose it is. The other side of the argument is if you've lost it, you can't use it. So it's kind of which came first sort of issue. There's still discussion about causes. As you can see, we're back to the possibility that a lot of what you're seeing, even at these higher levels of cognitive function, in terms of intellectual function, a lot of what you're seeing still may be the effects of slowing of cognitive processing, running a lot of effects of other abilities, whether they're time or not. We still need to think about the cause of that, and at least it kind of gives you maybe a more unified kind of thing what can cause it. There's still issues about education, and particularly about health. Moyer has argued in the Seattle data, off and on for several decades, that cardiovascular health and disease have an effect on the intellectual change, and if you take out people who have some degree of cardiovascular illness, you get a lot less people declining in the later years. And if you go back retrospectively and sort of back out of the sample people that eventually develop cardiovascular illnesses, you can even show that people who are not yet ill are pulling down the mean. So it may not be not just people who are already have congestive heart failure or strokes or other things that are obviously affecting electrical functioning, but people who are on the way to getting it, you may be pulling down the means. Another line of evidence that's mostly been coming from one research group is Martin Slowinski and his colleagues, mostly using panels out of the Bronx Medical Center in the greater New York area, have been trying to deal with the dementia question. Like a lot of the other experimental research we've been talking about so far, and of course, in this research as well, it's probably a good bet that people who are at least moderately demented would not be in the study. I would say probably with some caution here. But certainly people in the earlier and milder stages of dementia, and even more certainly people who have not yet been diagnosed with dementia, could very easily be in the study. And what Slowinski and his colleagues do, because it's pretty much the only thing that you could do, is you're following this panel of people longitudinally for years and years, and you wait and see who gets demented, and you go back and retrospectively take those people out of your sample all the way back, and you largely flatten most of the declining curves. You can see the data that we've been looking at longitudinally. Depending on the particular report, they don't, not every ability totally flattens out. You certainly get a lot less decline even in the post-70, post-80 years. So in some ways, the question is still kind of out as to whether there are serious normal aging changes in intelligence at this level at all. It could be that most of it is actually dementia and other diseases that would be disease related rather than normal development related. We don't know that yet. We need more research to kind of sort that out, but it's this whole the complications or the questions about how do we spot people with dementia early enough to actually get good estimates of what non-demented normal aging looks like. And conversely, on the dementia diagnosis side, a lot of people working on dementia diagnoses have not been very well educated about presumed normal aging changes, and so have tried to identify early stage dementia using tests that pretty clearly be changing with normal aging. And people are still doing this. Some of the first attempts were trying to look at slowing as evidence of early dementia. If slowing is consistent with part of adult development and aging, it's not a good choice for spotting early dementia. It's very, very difficult to separate those two. And one of the problems we've had is, I think, until the last 10, 15 years, these have tended to be sort of oddly parallel literatures. The people who study dementia have largely not looked at normal aging. The people who have looked at normal aging have largely not studied dementia. Yeah, that's a good response. Maria's shaking her head. There are some exceptions, but not tons. I mean, it's only been the last decade that they've been kind of growing as a